Hi everyone, good morning and good afternoon. My name is Carmen Yu. I am the marketing coordinator here at eFolder and your host for today's event. Welcome to our eFolder Partner Chat series. This webinar series brings together leading eFolder partners and eFolder partners for business-oriented discussions. The topic we will be covering today is making the case for secure file sync in the medical vertical. Today we are extremely excited to be joined by not one, but 3 eFolder partners whom I will be introducing shortly. There we go. So before we go through today's agenda, let's first cover a few housekeeping items. Today's session is being recorded. The recorded version of the webinar will be made available on eFolder's YouTube channel. We will also make copies of the slides available to those who registered for the event. With over 90 people registered for today's session, we have put all participants in listen-only mode. You can enjoy the audio portion of today's event by either streaming it on your computer or by dialing in over the phone. I want to stress that questions are strongly encouraged throughout. We have planned a special Q&A section at the end of today's discussion, but you may submit your questions as we go along and we will try our best to address them on the fly. So today's presentation follows a logical flow. After introducing our guests, we will go over what HIPAA is and why MSPs need to comply with the Act. Then we will briefly introduce eFolder Anchor, a business-grade file sync solution. And then we'll go into an interactive discussion with our partner panel and hear how they promote and sell secure file sync to their medical clients. Next, we will go over the requisites for selling file sync to medical clients. And finally, we will open up the floor to questions from everyone in the audience. So now let me introduce our 3 partner guests. On the line with us today, we have Alan Hellbush, president of Where to Start, based out of Fremont, California. We also have Antonio Strong, president of The Brass Effect, based out of Frisco, Texas. And finally, we have Mike Gill, CEO of CIO Systems of Silicon Valley, based out of Sunnyvale, California. Alan, Antonio, and Mike, thank you all so much for joining us today and welcome.
Thank you.
So now I want to give a chance for each of the partners on the panel to tell us a little bit about themselves. So Alan, why don't you give us a little bit of a background on yourself and tell us about Where to Start.
Thank you, Carmen. Hello, everyone. My name is Alan Hellbush, and I'm the president of Where to Start, Inc. I have over 30 years of IT experience with 15 years in the healthcare IT world. A little bit of my background, I've been selected by SMB Nation and SMBTN to be a member of the SMB 150 for 3 years in a row. A little bit about my company. It was founded in 1991 with its primary customer focus of healthcare and manufacturing clients. We actively have pursued an MSP trust mark from CompTIA, and we've been a member of the Ingram Micro SMB 500 for 3 years in a row also. Thank you.
Great. Alan, I want to ask, what are the primary IT solutions that you deploy to your solutions? I mean, to your clients, sorry.
We're full service MSP, so we provide all those typical services that you would do with an emphasis on providing security around the solutions and that complete solution. So it's a natural fit for most healthcare organizations. So backup, antivirus monitoring, file sync of what we're talking about today, disaster recovery, and full help desk. Great,
cool. Thank you so much, Alan. So next we have Antonio from the Brass Effect. Antonio, would you like to tell us a little bit about you and the Brass Effect?
Sure. We're located here in the Frisco area, probably one of the booming areas going on in the Texas area right now. As was stated earlier, as a managed service provider, we provide full service IT, but our concentration, especially in the last few years, has really been on compliance. We see a growing need in that particular area, whether it's in cybersecurity or whether it's in just helping the customers overall understanding their security and compliance profile. So our client base currently, for the most part, we probably split it up between accounting, medical, and we do have some manufacturing as well. So over the past, like I said, probably 2 years, we've seen a real uptick in compliance and or needs for compliance, and that's really where we're trying to make our mark within the industry and utilizing the Anchor product.
Great, thank you. Well, thanks for joining us, Antonio.
Mm-hmm.
And last but not least, we have Mike from CIO Systems of Silicon Valley. Mike, would you like to give us a little bit of a background here?
Sure. I'm Mike Gill. I'm the managing partner of CIO Systems of Silicon Valley. We've been in business since 2003. We're also a full-service managed services IT provider, and we focus mainly on bringing end-user customers to the cloud, and we also white label host applications for Microsoft software vendors. So companies that don't have their own hosted offering or don't have a web-based offering find that we tailor solutions for them to deliver applications to their customers. And one of our focuses is healthcare, and we have a couple of large software providers who use us to do their white label hosting. And over probably 3 years ago, we needed to change from Dropbox for file sharing and find a HIPAA compliant solution that will run on Microsoft terminal servers, which Box, who claims to be HIPAA compliant, will not do. They don't have it on terminal server. So we implemented eFolder, and it's a great product. Thanks.
Wow. Great, thank you. Thanks for that insight. Okay, so as we get into the meat of today's discussion, I thought we'd go over, some background on what HIPAA is for those on the line that might not be too familiar. So HIPAA is also known as the Health Insurance Portability and Accountability Act, and it was first passed in 1996. The purpose of the act, addressed in Title I, was to increase the portability and accessibility of health insurance by ensuring that employees who are switching or leaving their jobs be able to retain their health coverage. Title II of the act was later added to reduce healthcare fraud and abuse. HIPAA basically sets industry-wide standards for how protected health information in both physical and electronic forms is stored, accessed, and transmitted. And why does this matter to MSPs? Well, obviously for your medical clients, there are regulations around how they handle electronic PHI, but in September of 2013, HIPAA added the final omnibus rule, which expanded the act so that business associates of covered entities are required to comply. Business associates are entities who provide services for covered entities and who might come in contact with ePHI. Therefore, as a result of the omnibus rule, MSPs who provide services for medical clients who might come into contact with patient data needs to comply with HIPAA. In the security rule of HIPAA, there are specific administrative, technical, and physical safeguards that mandate exactly how ePHI should be protected, and it is really the security rule of the act that MSPs and their medical clients should pay close attention to. And before we go into discussion with our three partners on the line, I want to just briefly introduce eFolder Anchor, the business-grade file sync solution that these three partners are currently deploying to their clients. Anchor is a secure file sync solution that is built for deployment by managed services providers. One of its channel-ready features is its multi-tenancy. From one dashboard, MSPs will be able to easily manage all their clients. And a few key features on Anchor: it is a HIPAA-compliant solution, so eFolder will sign business associate agreements with our partners. Using Anchor, clients can easily access files using a desktop agent via the web browser or on their mobile devices using the mobile app. Anchor also has secure sharing features that allow the sender to expire share links or set download limits. Anchor also has an Outlook plugin, making it easy for end users to attach files without interrupting their workflows. And one of the flagship features of Anchor, file server enablement, allow MSPs to map files from clients' existing file servers to team share folders in Anchor, making those files accessible in the cloud. And finally, Anchor has security and administrative features that give MSPs and IT administrators control over data. Some of these features include detailed activity logs, the ability to remotely wipe Anchor files from devices, and mass revision rollback. So now let's get into discussion with the partners we have on the panel. So the first question I have is, when and how did you start serving medical clients? So maybe Antonio, you could start first.
Well, we started serving medical clients right around, I'd say probably about 3 years ago. We had one particular client who's a billing client, and we provided basic managed IT services. And as it turned out, while we were there, we actually started seeing a need because we started seeing more and more Dropbox in basically used between all their users. And so as I start looking around and start getting more into the HIPAA law and understanding more about Dropbox and the features and what it can and couldn't do, I actually start looking around for something that was HIPAA compliant, and basically that's how we fell into using the Anchor product. And since then, this particular client has over 100 users utilizing the product.
Great. Thank you. So Alan, what about you?
So I actually started in 2001, went initially into a client who needed some work on their firewall. And as a result of that, I actually never left the client. So in the sense that I stayed to do their IT and eventually took over all their IT functionality, or functions I should say, and became their IT department over the time. So like I said, I started with security in the firewall. As HIPAA came into place and we could actually see what that really meant, and as more and more information was being turned or being generated electronically with the EHRs and the need to send information securely, that's when we came across the Anchor solution and started to use it. And it grew from there with the backup and other pieces of that also, BDR backup.
Great. And Mike, what about you?
We were referred to a multi-location medical practice that was having problems managing their application in-house. Typical IT situation where you have the underperforming IT guy who comes in 3 days a week, the Dell server's on the floor full of cobwebs. So we started to talk to this client about moving their applications to our data center. And during this process, we started talking to their software vendor for their practice management system. And we found that if we were to put this in the data center, this particular medical practice needed to upload photographs of their patients to our cloud servers. And the way we would do that was with, we were looking at Dropbox to do that, but then we realized it wasn't HIPAA compliant. And somehow, I don't remember how I found eFolder. It was Anchor, it was before eFolder bought Anchor, and we implemented it and we did the due diligence and it works perfectly and it solved the problem. And because of that, then we took on more clients from this software company who referred their customers to us.
Great. It seems like each of you, started working with medical clients and then felt the need to, start complying with HIPAA. So I'm wondering, what did you do to get yourselves educated on HIPAA and its regulations?
This is Mike Gill talking. We still find HIPAA to be kind of nebulous. The strict definitions of what's needed and what isn't, it's kind of hard to find an actual requirements document with a checklist of things that need to be done. we realize that you have to do offsite backups. You have to have physical and electronic security. You have to have password resets. But to find every single thing is, some of it we do, and then some of it is incumbent on the end user customer to do and their software provider. So it's kind of a three-way partnership and trying to figure it all out.
This is Alan. I don't think anybody can really become an expert, so to speak, on HIPAA because it's changing, and a lot of it hasn't gone through the courts yet to be said this is exactly what you must do. So a lot of it's open to interpretation. What I would say is to look at everything and follow best practice for security, and look a lot at the SANS type documentation for your checklist for best practices and so forth, and then adapt from there. I have yet to find a single source solution for education of this is what you need to do, or educate people on what to do, because it differs, and a lot of this, like I said, has not been vetted in the courts and said you must do this. That's starting to change, but a lot of that is still out there. It's still open for interpretation.
Right.
Well, this is Antonio, and I'm just gonna add to it. Basically, it's a whole lot of reading. There are a lot of laws that are out there that a lot of people don't pay attention to, HIPAA being one of those. But over the last few years, as we said, one of those rules kicked in. I actually went through that thing, and it was just for the benefit of the customer, so they have more of an understanding. And at the same time, it kind of makes us the experts when we're talking about different things, especially when you're talking about to medical clients and you're talking to them about stuff they have no idea about. So that actually adds more value, as far as when we're actually recommending and bringing services to them.
Yep, exactly. Yeah, the rules of HIPAA are definitely vague. So Mike, I think we have a question from Peter in the audience. I think this is for you. He's asking, what software provider are you referring to? Is it a HIPAA compliant software?
Because it is HIPAA, and I didn't speak to the customer to use their name prior to this meeting, I really can't tell you.
Okay, yeah,
confidentiality with who we host, because we are a white label hoster. Okay,
yeah, that makes sense. Okay, so each of you have taken steps to get familiar with the rules of HIPAA. So I'm wondering if any of you provide HIPAA consulting services to your clients.
Directly related to HIPAA, no. HIPAA is a general underlying principle in everything that we do for them. So is it HIPAA consulting services for your clients? There's a component of it in everything that we do. Is it specific a line item that says this is HIPAA and this is your training? There may be something associated to that, but it's actually integrated in everything that you do and how you do it. So to answer the question, yes, we do it. Is it broken out as a specific line item? No, because it encompasses everything that we do. It's probably the best way I could answer that.
Okay, thanks, Alan. What about you, Antonio?
I would say yeah, because what you find out is that you have to be careful. And one, you have to be very, very careful because you don't want the liability associated with saying that you're recommending someone do something, and then something happens, and now they're saying, hey, we were told to do this by this particular consultant. So you have to be very, very careful. You can recommend, and you also want to make sure when you're making recommendations that you don't necessarily tell them one particular thing. So it's kind of tricky, but at the same time, that's where, you bringing yourself abreast of the law, knowing what you can and can't say as far as the, security, as far as the technical side is concerned. So really, we like to kind of focus on the areas that we know a lot about. But as was stated earlier, this really is a partnership. And when you engage the customer, you have to let them know there are things that you have to do on your side as well. So we do consult, but we're very, very careful in the sense of how we consult in terms of making sure that we always give the customer options.
Right, that makes sense. Thanks. What about you, Mike?
We do not provide HIPAA consulting to end user customers.
Okay.
We'll make sure that the requirements are met. If our software companies, require a solution, we'll do the due diligence on what we're providing. But no HIPAA consulting.
And I want to just stress one thing, if I might, that this is a true partnership between yourself, your firm, and the client. You have to approach this as a partnership. I know this is an overused term, but you must become their trusted partner in the sense that you're going to have some discussions, they're going to end up needing to do stuff, you're going to need to do things. You have to approach this. You can't go in and say, here, I'm going to do this, this, and then they're going to expect everything's there. There is components that they have to do. They have to take ownership of pieces around training, around documentation, whatever it is that they have to go off into doing. So it's very much a partnership. And if you approach it like that, I think you will be successful in that.
Yeah, agree. Thank you for that insight. So I know each of you kind of touched on how you started using Anchor, but I was wondering if there's anything any of you would like to add. Maybe there was another solution that you were evaluating prior to Anchor.
I think all of us said that Dropbox was one.
Yeah, I think I heard that.
Dropbox, that's what CIO Systems evaluated. But as I said before, Box won't work on a delivery platform, and Dropbox isn't. At least the Dropbox, when we had to find a solution, didn't have it. I don't know if Dropbox for Business is HIPAA compliant. We just don't have to look at anything else because Anchor works so well. So,
right. Yeah,
we're lucky that we don't have to search for somebody else.
Glad to hear that.
One of the good things, just to say also, we host Anchor in our data center, so we know where it is. Our customer knows where it is. One of our selling points is if the end user customer wants to come see the lights blink on the servers where their stuff is running, we'll bring them in there and show them, which AWS and Google and Azure can't do. So, we have their stuff, they know where it is, and they can see the disk drives blinking that their stuff's running on. So, good point.
Yeah, that's awesome. Thank you for sharing. So now let's, hear a little bit about how each of you deploy Anchor to your clients or promote it to clients who are probably using non-compliant file sharing methods. So first we have a case study that Alan, you told me. So do you want to, speak to this?
Sure. So where I initially started using Anchor was at a FQHC client who was who basically took all their laptops, went at home, worked on stuff and so forth, and we had huge issues with keeping everything in sync. We tried offline files, little success with that. They ended up emailing files back and forth to themselves a lot of times or amongst other people. And the side effects of that was documents versioning couldn't be kept track of, the email archives, and also the size of the data store just kept on growing with attachments. And we also had no real visibility into where those documents were going. Yes, we could see them in the email archives that they sent them to XYZ, but we also realized that there was a potential that they could be sent off-site. So we needed a solution to securely share files amongst the team. So we immediately glommed onto the fact that Anchor has the file server enabled all of the file servers, and then proceeded to, based upon groups, push those out to the corresponding people who then could then start to sync everything back and forth. That actually worked quite well to the point where everybody moved files back and forth, and everything was kind of kept in sync, no pun intended there, and the size of emails diminished. So the side effects of that essentially was the email archives became smaller, and I should say what was being archived became smaller. And then also the full document histories was being maintained because everything was always in the same spot. Similar to this, go ahead.
Oh, no, sorry, go ahead, Alan.
Another case of this where that was mostly the executives that were doing this, but we've also used the Anchor product in a dental office where they needed to exchange x-rays with other parties, both to and from, and we use it there to do that, where we create a share, and then that link to that share is sent off to various parties who then can retrieve or place files into that, and we know it's securely there, and it is auditable because it is in the logs and so forth there. So those are kind of the two that are related to, in this case, an FQHC, which is a federally qualified health center that meets the HIPAA requirements and so forth.
Got it. So for the medical clinic side, how did you realize that they were transferring these files via email?
Well, we saw the email size going up quite a bit in the sense that we knew what our amount of emails that was being archived going back and forth, plus we could also see it through the email gateways. The other interesting thing that we saw, but we couldn't quite figure out what was going on initially, was that people were installing Dropbox themselves. If they had rights, most of them didn't, so they were using the web version, but we were starting to see links coming back from Dropbox saying that there were files available. So we kind of got an idea that there was emails that were, or not emails, but documents were being shared outside of the scope of email and so forth, and we had no visibility into, and so we did a few other things to kind of stop Dropbox from being used. And if anybody's curious, well, we can bring that up later in the questions of how we determined that.
Okay, and just to clarify, when you say they don't have rights, do you mean that Dropbox is a blocked application on their devices?
Correct. They cannot install Dropbox because A, they don't have administrative rights to do that, and some people were able to get around that because they did. So therefore we went to different other mechanisms to determine if it was being there through our RMM package.
Got it. So once you realized that these attachments were getting sent through emails, how did you, bring it up to the client? How did you let them know that this was not secure and that you had a better solution for them?
Actually, through another product, another vendor, not a sync product. We actually did a search the archive for anything that had Dropbox in it, link to Dropbox or a reference to Dropbox, and basically just ran a list of all that and showed to the executive staff that this was actually being actively done. And at that point, it was kind of an eye-opener because everybody had that aha moment, oh, this is not to be, we said this shouldn't be done, but yet it's going on. So we did that. So we basically used the archiving solution to do a global search across all emails for anything to do with Dropbox. Is how we discovered it after, or I should say how we confirmed it. We discovered it because we saw things that were growing, and we also saw some links coming by, and also some general questions, hey, I can't install Dropbox, and can you install it for me? But people quickly figured out that that wasn't going to work, and so they started using other alternative mechanisms to get it. Right.
And the executive team, they realized, the risk that they were assuming right away.
Oh, yes. We had just gone through a risk assessment, and so this was not identified in the risk assessment, but it was actually very, very fresh in everybody's mind of the risk assessment. So it was a very easy sale from that standpoint.
Got it. Great. Well, thanks for sharing that with us, Alan. So Antonio, you shared a case study with me about a medical billing client. Would you like to speak a little bit about that?
Sure. So this particular client, as I said, they, because I was at the location often, I could kind of see, how they conducted business on a day-to-day manner, and in getting involved in more with compliance with this particular customer, we could see kind of, what they did. And one of the things that they did is that they shared information back and forth, whether it was referrals or it was patient information in regards to, x-rays, just different things. And a lot of it was happening via Dropbox. And, from what we all know is, Dropbox is pretty popular. And as I like to say, it's a great product, but it doesn't necessarily belong in every business. And in this particular case, we always, we'll definitely tout, the Anchor product in terms of being HIPAA compliant, and actually going through it and tell people why Dropbox is not compliant. So just education as far as that was concerned. And then once we found the solution, we showed them it was just as easy as using Dropbox. And yes, from an end user standpoint, they don't really care. They know Dropbox. Hey, this is what these guys down here are using, and so it really comes with training and explaining why someone should not be doing something. And then when you explain it to upper management, hey, this is kind of what you're opening yourself to, and explain it to them. Hey, what happens if one of your employees leaves the company and they have access to all this PHI? Do you know you're still liable for that? And so when you hit them with those types of questions, and then the eyes start to open up a little bit, and then when you show them some of the fines and you show them how employees are actually doing the stuff that we're talking about, then, as it was stated earlier, it becomes an easy sell. Once it's recognized that, hey, this is actually something that can actually save you money in the long run, it's one of those things that it becomes an easy spend. So from that perspective, this particular client is really the genesis to why we actually started using the product, and how we had the mindset that, hey, if we can do it for one, we can do it for multiple.
Wow, great. So how did you detect that this client was using Dropbox?
Oh, like I said, I was there often, so I could see on a daily basis kind of what they did. Now, as a managed service provider, we had a BAA with them because, we do the off-site backups. So, we were doing stuff already. We were already in there. And as we can see more and more how users tended to conduct operations, then we could notice that the Dropbox product was actually installed.
And I know you mentioned that with this particular client, they have 90 accounts that they use with the medical offices that they provide billing services for. So do any of those associates have any problems using Anchor?
No. And, we also provide support for them when necessary. But it's one of those things, it's like, this goes back to the partnership. If, this particular case, when this billing company can explain to the other offices, whether it's a surgical center or whomever it may be, this is the reason why we use this particular product. It's easier for everyone, and at the same time, it complies with HIPAA. So, once they have that understanding, and once they see that the product works just as well, we don't have any issues.
Got it. And did you rebrand Anchor to Access Cloud Sync when you first deployed it to this client?
Absolutely.
That's great. I'm glad you're taking advantage of that feature. Well, thanks for sharing that with us, Antonio.
Okay.
Great. So, Mike, I know you shared a study about a plastic surgeon's office with me. Could you tell us a little bit about that?
That was the one that I referred to earlier, the
right.
need to securely send photos from their desktop in the office to the cloud. Mm-hmm.
And they were using Dropbox. How did you figure that out?
It was right there. That was how they were. Well, they were using it in their office just to store files and share between laptops. They didn't have a cloud solution, so we moved them over to Anchor, and we branded Anchor right away. We call it CIO Sync. So So the app on a smartphone or an iPad or a PC or a Mac, all branded easy, simple to use.
Got
And
it.
I think I also told you that we ran into a little bug in your software, and your tech team worked really closely with us and turned around a fix. There was a Macintosh problem where if a Mac would go to sleep, it would lose the anchor connection. It wouldn't start up again and sync. And they solved it in a couple of days and turned it around for us really quickly. So we made a customer very happy.
That's great. Well, thanks for detecting that problem with us.
Yeah,
so when you tried to switch this client away from Dropbox and to CIO Sync, did they have any objections? Did they have any problems adopting the solution?
No, not at all. You know, we just say, you need to be HIPAA compliant, go with this. It's easy.
Okay,
It's a no-brainer. It works like Dropbox. I mean, what's the difference? It has a client, it installs, it's easy, they don't have to think about it. These aren't real technical people. So they want something they don't have to think about. And you don't have to think about Anchor.
Yep, that's right. Great. Well, thank you to the three of you for sharing your case studies. Now I have a few additional questions for you guys. How do you communicate the value of a HIPAA compliant file sync solution to your clients? I think you each kind of touched on this already. Do any of you have anything to add?
This is Antonio. Well, I think most of us, when we get into this business, you really want to take care of your customer. And this is one of those blind spots, especially if you're dealing with, a doctor's office, for instance. Their biggest focus is, they really want to, take care of their patient. And, at the end of the day, we're kind of doing the same thing. We have to take care of them. And, when you explain to them, this is something that can shut you down. You can go out of business. You can have an employee, a rogue employee, that does something that they didn't think was actually a violation, and the next thing you know, your door is closed. So it's if you actually care, for your clients and what you're trying to do, then it's incumbent upon us, if we serve the medical industry, to actually learn what's out there, learn how we can support the customer, and at the end of the day, it creates a better relationship for everybody.
Alan, any thoughts here?
This is becoming easier to do as everybody is aware of that they have to become HIPAA compliant. A few years ago, even dentists didn't think they had to be, and that's quickly changing. So it's becoming easier. I think the real benefit here is I think people understand that they need to ask the question, but I don't think they know how to ask the question and also how to interpret the results that come back. And I think if you hand them a solution and you say that it does all this and it meets it for this reasons, I think that that goes a long ways in communicating the value, because A, it's taking it off their plate, they don't need to do it, and then you go back and you take some of the risk for that. Again, going back to this partnership, there's also a shared risk in a lot of this sort of stuff. And as MSPs, we need to be thinking about that more and more.
Great.
And Anchor solves that. I don't need to think about that because I know it's a case. I know that I have a business associate agreement there, and I know that everything's been met and audited. So it removes that from there.
Right. And how do you guys typically, do your clients typically object? If they do, how do you handle the objections? And, maybe if you sign BAAs with your clients, or you further educate them?
I think we have to sign a BAA. I don't think we really have a choice for that. The objections, I think if they really understand what they're doing and how the information is moving, I don't think that there really are that many objections to this. I think it's just become something that is part of business and part of the cost of doing business and getting stuff done. I think there's also a lot of, if it doesn't get in the way of them doing their workflow and it's as transparent as possible, I think that's also, once they see the product in practice and understand that they are going to to get their auditing reports if they request them and go through that, I think that the objections basically go away.
Got it. Antonio, anything to add here?
One of the biggest things is that, you know, there are objections, but as they understand, you really don't have a choice. If you are in the medical industry, if you provide services and you bill insurance, you fall under the HIPAA law, period. And so the more education in terms of what actually needs to be done as far as their perspective is concerned in terms of trying to be compliant, for those who want to be compliant, there are really not a ton of objections. But if you have those that you run into where they're just looking at cost alone, those are the types of people that I've run into that, you know, might have an issue. Well, how much does this cost? And, you know, and so if they really want to adhere to what the law says, you don't have a ton of objections.
Right. Great. So, you know, Antonio, you brought up cost. I'm actually wondering, it's not a question I have on this slide, but how do each of you price and package your file sync offering, especially since many of you had clients who were previously using Dropbox, which might have been free, and now with Anchor, they actually have to pay a fee for it. So how do you communicate the value of what they are paying for?
CIO Systems, sorry. At CIO Systems, we offer it in 5 GB increments as part of their monthly charge.
Okay, and is it based into their managed services contract?
Yes.
Okay, and clients are typically okay with this?
Yes.
And
we put it as a line. We put it as a line item on the server quote.
Okay, and do your clients typically go over the 5 GB?
It's all over the place. Some do, some don't.
Okay.
We set a pretty short deletion time for them. I think it's probably because it's a transfer folder and they understand that. That's what we use it for, especially for medical clients. They're just transferring files from their local systems to the cloud server. So we have those files delete after a week.
Got it.
Yeah, once it's on our server, it's all backed up. So they can have it off their system in the office and they don't care.
Cool. So Alan, what about you?
So mine, for the medical clients, it's actually bundled in. With the file server enablement, we would easily exceed the 5 GB. So it's just their allocated amount of space, and then we adjust it appropriately. But it's bundled in. It is a listed item, not priced separately, but it's as an included service. It's listed. So it's there, but it's not. They can't break it out and do price shop you, and so to speak.
Got it. What about you, Antonio?
We think that the Anchor product is a great product. So the way we've basically presented it is that it competes with anything out there, whether it be Box or Dropbox or SugarSync or even Citrix ShareFile. We've come up against that. We've actually had people who've switched, from each solution because of whether they've had one hiccup or the other. So the way we look at it, we try to price it comparatively based off of the other solutions that are out there, and we're having success doing it.
Great. So actually, David from the audience just asked if any of you have ever compared Anchor to Citrix ShareFile. So, Antonio, do you have any insights on this?
Yeah, we actually have a matter of fact, we just brought a law firm down in Florida that was using ShareFile. Matter of fact, their IT company actually tried us out, and he's the one that recommended it, and we've had them probably for about 4 months now. So in regards to that, I guess it fares well, if not better than.
That's great. That's good to hear. Cool. So Finally, I wanted to ask, for Antonio and Mike, I know you guys rebrand Anchor. So how has the ability to rebrand Anchor benefited your MSP business? And just overall, how has deploying a secure managed file sync solution given you and your clients peace of mind?
Well, this is Antonio. Like for me, what we do is that we try to bring the best products, the best solutions to our clients. Period. And we're not focused on one particular thing. If it works best, that's what we want to bring to the table. And so when we branded the solution, the goal was to bring something to the table that is a little bit different than the other products that are out there. And I think we've accomplished that. We've gathered customers from places that we had no idea, and it's basically because of how we were actually able to rebrand the Anchor solution.
Great. And Mike, what about you?
We like to have a consistent look and feel on everything that we offer, but we're small, we're not Microsoft, so I don't think it particularly matters whether it has our logo on it. We just like it to be there, and just keep it easy for the customer. And again, we have the same exact ethic, the best tool for the job. We don't sell a product because we make more money on it if it's inferior. So we're open to everything. And I didn't talk about Citrix. I think that's a big product. We offer that also, but it's a little difficult sometimes for customers to get their heads around because it has so much included. Anchor's a little more specific to a solution for easy file sharing. So, good.
Great. Anything to add, Alan?
We don't rebrand the product as a name, but everybody has their own company logo on it, so they see their stuff. So when they open the mobile app, they see their logo. When in that respect, I just felt that it was kind of more like that they owned it, not that we owned it. That they owned it is why we did it that way. I do firmly agree that it is the best tool for the job. I would not be doing this from the standpoint of putting the tool out there and putting my reputation if I didn't believe that.
Great, thank you. So before we, start to answer questions from the audience, I just want to go over some requisites for selling file sync to medical clients, and hopefully MSPs who are on the line will find this useful. So, first, if you're thinking about selling file sync or, any solutions to medical clients, you should really learn about HIPAA and also train your employees about HIPAA as well. Like a few of the partners on our panel have mentioned, the rules of HIPAA could be very vague. So sometimes it might be a good idea to get a consultation from an expert. Also, it's also important to implement HIPAA-specific policies and procedures in your clients' businesses and your own business as well. And it's also really important to conduct a yearly risk assessment because it will give you direction on where to start making changes in your policies and procedures. And also, if your business was ever going to be audited, that yearly risk assessment is really going to help show that you have been complying or trying your best to comply with HIPAA. And as a few of the partners have mentioned, you should make sure you sign BAAs with your vendors and your clients as well, because that way all parties involved will have the most peace of mind. And lastly, this goes in hand with signing business associate agreements, but you should deploy IT solutions that are HIPAA compliant. And before we answer questions, I just want to let everyone on the line know that if you are interested in trying Anchor and experiencing the features for yourself, eFolder is currently offering a free 25-user NFR, not for resale licenses, to IT channel partners. So you can sign up for your 25-user NFR at www.efolder.net/AnchorNFR. So now I'm going to go ahead and turn to the Q&A log and check for questions. So Peter asked, are your clients currently doing annual risk assessments? Alan, do you know if your clients are?
Yes, they have to for meaningful use. To get the dollars for that, they have to conduct a meaningful risk assessment.
Okay, and what about you, Antonio?
They have to. As a matter of fact, what you find out is that if they're not, then they're immediately not compliant. The OCR actually put out a free risk assessment solution on their site. I don't know, about six plus months ago, and just so that people will know that that actually has to be done.
Okay, great. Wow, so there's a free risk assessment tool.
Yes.
Cool. Mike, do you have anything to add here?
No, we don't know whether our clients do risk assessments or not.
Okay, and Peter also asked another question, and I think, Alan, you might have an answer for this, but have you eliminated the need for a server due to the use of Anchor?
I have not eliminated the use for it because I still have vast number of people in the office who are still doing stuff locally. With the local recent land sync, and then also with, I think it is possible in the near future for smaller offices to eliminate a file server. And I'm going to qualify that depending upon their line of business application.
Mm-hmm. What about the client that you use the file server enablement feature for? Do you think they will be eliminating their file server anytime soon?
Based upon how they use information and the history of everything that's there, and also at their comfort level, I'm going to say no. Is it possible? Yes, but not practicality given the client, no.
Fair enough. So Michael asked a question that I think any of you could answer. Are all of your workstations and laptops encrypted for the local storage of Anchor files?
Anchor itself is not encrypted, but the hard drives are encrypted.
Got it. Antonio, Mike, anything to add here?
Yeah, that's the right answer. If they're a medical client, all their data needs to be encrypted. Period. That's a
right.
part of the technical rule.
Okay, so we have a question from John. He says that he assumes that most doctors are using EHR and practice management software to store EPHI in their database. So when your end users need to share EPHI from these software, what's the typical process to share these records? Are the clients having to do a multi-step process where they need to export the records and then save it to eFolder and then share the link?
I think a lot depends upon what information they're sharing, plus also where the information is going to. If it's leaving the facility, then you have to, there are many other questions about how and what format that the information is going to be delivered, even whether they're on a local exchange, health information exchange, or anything like that. So the quick and dirty answer is that there are too many variables in that to answer the question. Technically, Anchor can do it, and the workflow would be no different than if they were going to print a document or export a document and then identify it and send it, usually an email with a link to it to the party, assuming that is outside of the organization. Like in the case of the dental office that I said, they would put x-rays in there. They would literally link to those files from inside of Outlook and say, here are the files, and then send the email off, and within that would be the link to the Anchor file that is shared. And then the person at the other end would log in to the portal and basically get the information. And you would have a record of it at that point that everything had taken place.
Right. Anything, Antonio or Mike, you guys want to add here?
No, not for me.
Okay, great. So I think we've answered all the questions in the Q&A log. I'm just going to give it another minute to see if there are any additional questions coming in. For those of you in the audience, if you do have any questions, please ask them now. Okay, great. So it looks like there are no more questions coming in. So, I just want to thank you, Alan, Antonio, and Mike. Thank you guys so much for being here with us today and sharing your insights. And I want to thank all of you who are in the audience for spending this hour with us. I hope you all found the information in today's webinar useful. And the recording and slides for this webinar will be sent out shortly after. Thank you guys so much. I hope you all have a good day.
Thank you.
Thank you, everybody.
Bye.